might have heard this term neurological claudication from your doctors, so let's explore more about it. So, for executive moms who are balancing a high stress job, younger kids, and spinal pain, experiencing unexpected leg pain, especially during your active hours when you're walking or standing or you are in a meeting, and you're walking around your office, it can be quite a additional stress in your everyday activity. So this could be a sign of neurological claudication. So in today's video, we are going to discuss what exactly this is and how does it happen, and what can you expect when you have neurological claudication. All right. So, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is, back and neck, and nerve pain, despite low energy levels and a lack of focus. Now, I do so by giving you simple exercises, some easy lifestyle modifications, some tips and tricks that have helped me in my own pain and adrenal fatigue, that is, low energy levels and lack of focus journey. So, I do all of this without taking a big chunk of your time because, hey, we're moms, we're busy people, right? So, let's get into the topic for today, which is neurological claudication explained and what executive moms need to know. Now, neurological claudication basically is a symptom which is often associated with lumbar canal stenosis, a topic that we recently discussed. If you're not sure what that is, you can go to my YouTube channel and check it out. So, stenosis is basically a narrowing of your spinal canal that puts pressure on your spinal nerves, and it can significantly impact your ability to stay active and to manage your everyday responsibilities. So, when the space in the spinal canal, let's talk about the lumbar canal, is narrowed, the compression of the nerve or irritation of the nerve can take place, and this can radiate the pain down into the leg. Now, your doctor might say you have a nerve pain or a neurological claudication or a neurogenic pain. These are mostly referred to. To the same, these all mean the same thing, which is basically a nerve pain. However, I will also come to another form of claudication a little later in the video. So, what happens with neurological claudication now? So, usually, neurological claudication will run in parallel with the symptoms run parallel to those of spinal stenosis. So, if you're watching this video and you watched my previous one, they might be a bit similar. But hear me out on this one. Neurological claudication typically will start to worsen, that is, your nerve pain down in the leg plus minus the back pain. So you may or may not have back pain depending on how severe your stenosis is. So the let's just refer to leg pain here. So neurological claudication will typically worsen when you're standing or walking, and it improves when you're sitting down or you're bending forwards. So that is why when we talked about the shopping cart sign yesterday, that involved bending over a shopping cart. So you might have seen some people around in the shopping mall who are bending over their shopping trolley or the shopping cart, and that makes them feel better because they are flexing their spine, their forward bend, they're putting their spine in a forward bent position, and that helps to relieve their spinal stenosis and thus their neurological claudication. Now, you may find that you may find a term called vascular claudication, which is completely different from neurological claudication. So what happens in vascular claudication is you have something called a peripheral arterial disease, where there's a problem with blood flow in the legs, and because of that you get this very severe cramping pain in the legs. But that is not something we're going to discuss today. So if you have vascular claudication, this is probably not the right video for you. This is more for nerve pain, stenosis, and neurological claudication. Now, I'm just looking at my notes here. Oh, yeah. In vascular claudication, the pain does not get better by bending forwards, but rather resting, because that resumes the blood supply in the leg. So there's nothing to do with the nerve compression there. So now, if you are walking, your symptoms of neurological claudication can worsen. However, when you're doing an uphill walk, you might find that the symptoms get better because and normally, to balance ourselves, we all tend to move a little bit into flexion or forward bend position when we have to go uphill. So coming downhill again, we are more extended. So that is a position in which your neurological claudication can increase. Now, managing claudication can involve a number of medical treatments and medications, maybe even surgery. However, what you can do on your own is more activity modification. So try and avoid or modify activities where you're extending your spine or bending backwards. And you can obviously work on strengthening your muscles around the spine, especially your core muscles. So core rehabilitation is very important. I'm not going to go into the details of this. Again, I've done videos of these on YouTube, so you can have a look there. Also, you need to make sure that the inflammation around your spine and in your nerves, because of that nerve irritation, the inflammation in your nerve is well managed. Now, if you're looking for an easy way to reduce inflammation in your body overall and in your spine and nerves, there is a free program which is known as 11-day Jumpstart that I have done myself and have experienced the benefits of it. There are many other people who have. So what I've done is I've left a link to the blog that I have written on this topic in the description of this video. On Instagram, it's in my bio, but if you can't find it, just message me, I'll send it across. In that blog, I have put in the details of this 11-day program. I also have a video in there that explains spinal stenosis in more details. And yeah, if you have any questions, any comments from today's video, do let me know. And I hope this was useful for you. Alrighty, I'll see you guys next time.